Hello, everyone. Welcome to our information gathering session pertaining to House Bill 200, which establishes the Healthcare Workforce Investment Fund. This is exciting legislation for both campuses and industry and will benefit the Commonwealth through strengthening the next generation of healthcare workforce. I'm Leslie Sizemore, Executive Director of Healthcare Workforce Initiatives at Kentucky's Council on Post-Secondary Education. We're joined by several strong partners and staff members today, including Representative Ken Fleming, the sponsor of House Bill 200, Jim Musser from the Kentucky Hospital Association, Daniel Check, Dean of Health Sciences at EKU, and CPE's own General Counsel, Travis Powell. To best assist you, we have an active question and answer box at the bottom of your screen. Feel free to drop your questions into this area as we won't have time for questions, at least not many questions, during this quick webinar. We'll be sure to thoughtfully answer those as best we can, and we'll post the Q&A document along with the recording of today's webinar on CPE's website. We'll probably also send it to you. So let's get started today. Representative Fleming represents the 48th District and was the sponsor for House Bill 200, which has gained national attention. Representative Fleming, could you tell us about your vision for this bill and why you felt it was important to implement this unique legislation?
Thank you, Dr. Sizemore. I appreciate the opportunity and CPE for being so involved and helpful in creating really a dynamic, impactful bill that take a lot of coordination among, 12 to 13 associations throughout the Commonwealth in order to make this come to fruition. It goes back, if you really look at it, it goes back to before the pandemic. But the pandemic really highlighted a lot of deficiencies and issues and challenges that we face throughout the Commonwealth. And since that time, there's been discussions within the General Assembly in terms of during the summer with the Health and Family Services, their education, and it came down to education and healthcare providers in terms of making sure that workforce has a big enough pipeline when it comes to providing not only education for kids, but just as important to provide quality care for our citizens throughout the Commonwealth. And so basically things really started materializing, I would say probably 1st of November. Been working with some individuals for some time, and things just happen to really fall into place. You know, sometimes you think that the most difficult, complex bill will take a long time, and then sometimes the most simplest ones will take short time, but that isn't the case, because I've come across some bills you thought was so simple and easy, it was a bear to get through. And then you think this is the complex, sometimes it goes through smoothly. And fortunately, through great cooperation with the private sector, CPE, and General Assembly, we got this thing that came together very expeditiously and thoroughly vetted in terms of this coming to fruition. So down the road, I mean, if you look at back in 2013, even the Kentucky Hospital Association produced a report. There's a deficiencies throughout the Commonwealth that not only from a professional standpoint, but also from a geographical point of view in terms of providing quality health care within the Commonwealth. And so through a lot of the discussions we've had, this came together. Like I said, they're a very collaborative and cooperative approach in terms of making this come to reality. So as Dr. Sizemore mentioned, we are very tickled to death in terms of the federal government is really looking at this bill. In fact, I'm going to be with a congressman next week about this bill to get this thing filed over the next month and a half in both chambers on the federal level. To making sure that states are given incentives from the federal government to implement some type of workforce in doing this. the impetus of this, not only of those discussions, Florida came with a bill that was just focused on the nurses. And I've been providing mental health services, for about 7 or 8 years. I run an agency. I don't have a mental health background in terms of being a license or whatever. I'm a business person, but given my exposure to mental health is a really big and eye-opening experience, and serving on the Health and Family Services, I got even a bigger exposure, and my eyes were really widened, and worked with the Kentucky Hospital Association and other entities to look at a broad spectrum, not just nurses, which they're basically a backbone to a lot of functions. But when you look at mental health, when you look at dental hygienists, radiologists, those types of professions, but also it really came into fruition when I worked on House Bill 777 that dealt with the ambulance services. There is a big deficiency in the eastern part of the state when it comes to that. So we want to broaden the spectrum in order to make sure we cover a wide spectrum, not just one particular profession, but a profession across the board. And like I said, this came into fruition. I know Travis will go over in a little more detail about the bill, but the intent is to get the public and private together as a partnership, leverage state dollars, so we can put in money for scholarships to bring the pipeline or enlarge the pipeline to bring people in through that process, but also to help out with universities and training centers to give them enough wherewithal to bring on faculty, to make sure that they have the equipment and training resources in order to get these individuals through the pipeline in an expeditious manner and get them out there into the field to provide those quality services and so forth. So I'm really excited. Dr. Sizemore has been very instrumental, and worked very closely with her and as well as Dr. Thomas in making sure this comes to a really good, strong conclusion to get things going. This is the beginning in terms of, I think it's going to be a really, really good impact on our healthcare services.
Thank you so much, Representative Fleming. It has been a pleasure to work with you as well, and to work with this whole team. I'm excited today to see that we have so many interested participants. We have over 100 people on today and have about 137 people registered. So there's obviously a lot of excitement about this bill, and we'll continue to flesh out all these details and work together more to be able to get those regulations finished and be able to start drawing down funds from this. Thank you. Next, it is my pleasure to welcome Jim Musser. Jim is the VP of Policy and Government Relations for the Kentucky Hospital Association. Jim, we constantly hear that Kentucky hospitals have a workforce shortage. Could you tell us a little bit more about that and how that has had an impact on Kentucky healthcare for employers and patients, and how House Bill 200 may help?
Let me get myself unmuted here, Leslie. Thank you, first of all, for including the Kentucky Hospital Association in the webinar today. I've got to start with a lot of thank yous. Thank you to you. Thank you to Dr. Thompson and all the team there at CPE. You have been great partners in this. We've been talking with our friends at the four-year institutions and at the Kentucky Community and Technical College system. And there's a real willingness to have people roll up their sleeves and work on this issue. We can't thank Representative Fleming enough for the great work on this really important piece of policy, and it's a smart policy because it's a public-private partnership. Everybody has some skin in the game because, to your very point, this has a huge impact on our patients and our ability to deliver quality care to our patients. While I represent the hospitals, our reason for being is to serve our people, to make sure that our patients are getting quality care, and that simply can't happen unless we have the trained workforce. So this is really a hand-in-glove partnership, and we're so appreciative for that. And I'm going to piggyback a little bit on what Representative Fleming said. I was in DC earlier this week and talked to members of both the House and Senate about workforce issues. And we told them, you've got a great model in Kentucky in House Bill 200. There was real interest, and they were thinking about, how could we scale this up nationally? So I think Representative Fleming really is ahead of the curve in his thinking on this bill, and we thank him and congratulate him. The fact that it passed so easily through the legislature really shows that there's a statewide commitment to improving our workforce, because there is a dramatic shortage. The Hospital Association does lots of research, and we put out a study last fall showing that there were 13,423 full-time equivalent vacancies across 12 professional groups. And you notice I say across multiple professional groups, because as much as we love our nurses, it's not just our nurses that we need. That said, the RNs and LPNs are absolutely the largest cohort there. There's a 22% vacancy rate in our nurses, and that is the front line for patient care. They're the heroes at the bedside. They're the ones who are there when you need them. There were questions back during the legislative session about, were there enough beds to handle all the COVID patients? The question wasn't the number of beds. There were an ample number of beds. The problem was, do we have the staff to serve the patients in those beds? And you couldn't use all of the beds because we simply didn't have the workers to do it. What's at work, Leslie, is really a demographic black swan. So if you think about the baby boom generation and how large that cohort is, and then the next cohort, my cohort, Generation X, not nearly as large, but still a fairly large cohort. Well, the baby boomers are in full-on retirement, and my cohort is close behind. So where are we going to get the workers that we need? Because there's simply not enough in those cohorts behind us to fill all the vacancies, because not only are they vacant, it tends to be, if it's the older nurses, they are the ones who are most experienced and are helping the new nurses to learn as they're coming on. So we've got a real challenge, and House Bill 200 is such an important step in the right direction, because it sets up the incentives for success. And I, again, just congratulate Representative Fleming and those involved in putting this piece of legislation together, because I think it strikes a very smart balance between scholarships and help to the institutions to have what they need to educate those students. In the previous session, Senate Bill 10 was also an important piece of legislation in helping us to address the worker shortage, but we quickly discovered that it didn't really matter how many seats there were available for the students if there weren't the faculty to teach the students. So again, this is another big step in the right direction. And, there's no silver bullet, because demographics are not going to be overcome overnight. But boy, what a great piece of legislation. And it's not just for the hospitals, it's also for the long-term care facilities, because as great as our vacancy rate is, the vacancy rate for their workers is even more extreme. They rely on LPNs, and they rely on the certified nurse assistants, and we're not getting enough of those either. Basically, name any health profession, and we need more. We need more imaging techs. We need more radio techs. We need everybody in the chain that's going to be serving the patient. And I've got to say, it's just so wonderful that we're all pulling in the same direction. I think it's so quintessentially Kentucky that all of these different partners are linking arms to try and solve a common problem of how do we deliver quality healthcare for the people of this state. It is absolutely our touchstone. The hospitals constantly are striving to address the issues that our patients need us to address so that they can have the best quality care that we can provide to them. So thank you again, and thank you again to Representative Fleming. We just can't say enough good things about him and his leadership on it. It's great when you have a problem solver in the legislature like Representative Fleming, and I know that is Dr. Thompson's position and your position, Leslie, that you want to be problem solvers. So thank you for being such great partners. I'm going to stop now because I want to hear from Dr. Check and from Travis because they have such important things to say.
Well, thank you again. We're so appreciative of you, Jim, and so appreciative of Nancy and both of your leadership over there at the Kentucky Hospital Association. When it comes to healthcare, that's just a sector that, of course, it's the largest workforce sector, but it's a sector that we just can't compromise on, because that is the health of our families, the health of all of Kentucky, our Kentuckians. Every person is affected. So I appreciate your referencing the long-term care facilities and really all of Kentucky hospitals and what they need. Next, I'd like to welcome Dr. Daniel Check. Dr. Daniel Check is the Dean of Health Services at Eastern Kentucky University. He is relatively new to Kentucky and came at a very interesting time for healthcare educational programs. Dr. Check, what does House Bill 200 mean for healthcare students and for healthcare professional programs?
Well, good afternoon, and thank you, Leslie. I have a PowerPoint here I'm going to share with everybody, so I'm going to hit share so everyone hopefully can see that. Okay, yes, my name is Daniel. Please call me Daniel. I've spent the last 25 years in the state of Georgia. And so in June, I ventured up to the Commonwealth, and I have enjoyed every single minute. I love the people here. I love Eastern Kentucky. I love EKU. It's just been a pleasure to be here. And one of the reasons why I've enjoyed my time is one of the first professionals I met when I moved up here was Dr. Leslie Sizemore. And from day one, I could see her energy, her work ethic was going to produce results, and it has. It's been pretty fantastic to see her vision, her leadership in motion regarding the Workforce Collaborative. And I can remember, Leslie, I imagine you can remember too, in June of last year, we had our first meeting, and there were many amazing ideas and visions, and those are coming to fruition, and it's pretty impressive to see. And of course, House Bill 200 is part of that. And since that meeting in June of last year, it's been inundated in my mind to motivate our college with initiatives to first strengthen that pipeline, right? So enrollment management from an academic perspective is very, very important at EKU. And the second, of course, you know, I always say the old Field of Dreams line, if you build it, they will come. Well, yeah, if we build it, they'll come, but we have to keep them here. So, you know, we need to really make sure that we support programs to increase retention, progression, and of course, graduation. And then recently with House Bill 200, we have initiatives hopefully to achieve CPE exemplary status for incentive funds. And so I want to share with you some of the ideas and why Health Bill 200 is important to us and what we've been doing since June of last year, which actually it happens that it works perfectly with the House bill. So, you know, EKU prides itself on as a school of opportunity, and the essence of this bill speaks 100% to this mission. All right, so we're providing university students with these scholarship opportunities, but also assist in employment upon graduation. And when we do that, it gives them hope, determination, and motivation. Which is fantastic to see, and I'm seeing it already with our students here at EKU. But we're also achieving that secondary goal of increasing the pipeline, and for us in historically underserved areas of the Commonwealth, because EKU is uniquely positioned in regards to we're close to the foothills of Appalachia, doorstep of urban Lexington, right? And we serve all of Eastern Kentucky with regional campuses and outreach. So we're excited about this House bill because we're going to be able to increase this pipeline. right? But what's interesting when we talk about the academy is that when you dig into the House bill, there are other partnership positives from an academic perspective, right? Other than the scholarships and the opportunities for employment, right? So as a dean, I see other goals and other positives. For example, adjunct faculty and class speakers. It'd be a great pool to create based on our town gown partnerships. And within that pool, students can see career mentors and advisors, ask questions from an applied perspective that our partners can help with. Of course, as a dean, normally colleges have leadership committees or advisory committees, and if we have a partner that can help us with being part of that committee, that will definitely help us from a research perspective. We can advise students, kind of really help us with our strategic planning. So that's a win-win. Of course, service learning projects, other service projects regarding everyone coming together, both students, faculty, staff, and as well as partners. And currently right now we're working with Anthem and Humana on different service projects, whether it be through Medicaid or health equity. I'm very excited about that. Of course, student volunteer hours, community in the classroom courses, applied research. That's something that we're really enhancing here at EKU. And last but not least is increasing resources for our students to achieve that exemplary status. So with that being said, since June, we've really worked on this notion of a center for RPG. And again, RPG stands for retention, progression, and graduation. And I say that notion of if we build it, they will come, but how do we keep them? Because that is a problem, right? I mean, we can get them here, but making sure that we have the retention, the progression, the graduation is paramount. So we renovated the entire second floor of one of our academic buildings to put a center up there. And we have numerous programs that I want to share with you to show the importance of RPG. All right. Of course, we have that academic coach peer mentoring program. We're developing a family identity of all the College of Health Science majors. So, we actually have a room with couches and TVs and refrigerators. So that between classes, people can come up and hang out and kind of just talk shop, if you will. And it's working. We have more people up there than ever. And it's really neat to see. We have new career development and support programs. We just introduced the NCLEX testing preparation program, which hopefully that will increase our NCLEX scores. We're measuring everything. We're maintaining our data repositories to make sure that what we're doing works. And that's kind of the essence. Now, a couple specific programs that I think are really going to help those initial students that come in that may not have the necessary prerequisites. First is Chess Lead, where we're going to bring students in for a week before move-in, and we're going to help them transition to college by just talking to them about social skills, mental health, do some team building, but also work on helping them pass the math support test, which also many times is a hindrance. And if we can have them pass that test, they can stay on track for graduation, which helps with that retention and progression. Another program that we are implementing this summer, it's called a Chess Inspire. And that's where they actually come on campus for a month. And 15 students will be here, and they'll actually take 2 courses, and it's going to be based on academic, emotional, and professional development goals, which is, I'm excited to see the byproduct of Chess Inspire, because I think it'll be pretty significant. A program that's near and dear to my heart, it's called Organizational Studies, and that's for that progression aspect of RPG. And it's for those juniors and sophomores, juniors. In the month of May, we are going to create a group of students that go and experience different organizations from a healthcare perspective. And not only in the state of Kentucky, but going to the CDC or even out to California or Chicago and seeing some of the medical centers out there, so that they can not only see and create contacts, but each organization offers up a problem that our students have to solve. So it's an applied experience. They get to meet people in the hopes that they can learn, and who knows, maybe they can experience a job afterwards. We have a holistic advising team that's second to none. We have a graduation coordinator that makes sure that our students graduate on time. Then we have a clinical agreement and compliance coordinator that makes sure that manages all the clinical contracts and facility onboarding. Now, one of the things that we talked about last June was the importance of reaching students early, right? So a program that we're so excited about, we partnered with Baptist Health Richmond, is called the Richmond Medical Explorers Academy. And I used to be in Medical Explorers when I was in high school, and it changed my life for the better. And so what we're doing is their junior year, we're bringing students in from local high schools, and 1 week they'll be with us, the next week they'll be with Baptist Health, just kind of learning about health science and all the different medical positions and disciplines that are out there. And then their senior year, Baptist Health has agreed to hire them as a tech assistant so that they can experience different disciplines. And initially we thought, well, maybe we'd have 6 to 8 students apply. We have 30 applications, and we're excited. And so we're going to take as many as we possibly can. And hopefully after that senior year, they'll have the opportunity either to stay on, at Baptist Health, or if they want to move into an academic program, they would have a pipeline into our programs. We also have the summer camps where students, high school students and middle school students come for a week, and they work on different health science problems, and they learn different disciplines. We actually have a specific Rogers Explorers camp for a week where students come on campus and learn a little bit about our programs. We've partnered with the YMCA Black Achievers, where we're going out and bringing the YMCA Black Achievers to campus to understand all the different disciplines and to go through different health science experiences. We've incorporated dual credit pre-nursing courses. We're working diligently with our vets, and what we've done is we allow veterans to use their experience to garner credentials so that they can graduate in 3 semesters from our associate's degree. Baptist Health has been a great partner already. They've donated 12 striker beds for our students for our SIM center. We've developed a new mental health center, not only for our nursing, psychiatric, mental health students, but also for our regular students who may need services. And then we've partnered with numerous organizations across the state in regards to tuition reduction to make sure that those workers, if they want to go on and enhance their education, they can. Something special at EKU is that we have free textbooks to all students, whether they be undergraduate or graduate students, which is pretty powerful. So with that being said, from this, we're seeing the fruits, right? Since June, in incorporating these initiatives, we've increased our enrollment from last year. For the first time, we've beat the College of Education, and we are the highest, we have the college with the highest retention rate at EKU. There's been a significant increase in morale. NCLEX pass rate has increased from the fall semester students coming through and taking those tests in comparison to last year. And then last but not least, we're increasing the number of CHESS graduates. So this bill is going to be instrumental in enhancing RPG and enhancing all the resources as well as student enrollment. And I'm just so grateful and thankful that I live in a state that makes this very, very important. And thank you for everyone who has created this bill and has worked diligently to make it come to pass. So thank you for your time, and go Colonels.
Thank you, Dr. Check. And it has been a pleasure to become friends and to work professionally toward this wonderful target, I think, which is really just developing a very highly skilled healthcare workforce in Kentucky. And EKU is definitely doing its part under your leadership, and I'm so appreciative. Lastly, I'm going to introduce my colleague, Travis Powell. Travis is a vice president and general counsel for CPE. He has been involved with House Bill 200 right from the start. His involvement has been critical to us for ensuring that this bill does what it's intended to do. Travis, could you take some time to go through this bill to provide our participants with details related to its specifics?
Absolutely. Thanks for the introduction, Leslie. Be glad to. Let me share my screen here, and then I'll have to move some things around, but we'll get it going. Leslie, does that look okay? Thank you. So I'm going to walk you all through the bill today, and just the different elements of the bill, and pretty much taking information directly from it, and just sort of walking you through functionally how this will work. And then at the end, I'll talk a little bit about the regulation promulgation process and the time frame for that. So to start off with, and this is language again pulled directly from the bill, is the overall intent of the legislation. And I think you'll find here, I certainly won't read this to you all, but I think you'll find that this aligns with everything that you've heard today from our speakers so far. The bill creates a healthcare workforce investment fund. And the purposes of the funding provided in this fund are for public and private partnerships to provide healthcare training scholarships and high demand eligible healthcare credentials, healthcare program incentive to reward performance and excellence amongst Kentucky's healthcare programs, and to also fund council administrative research funding and planning functions, not to exceed 4% of the money in the fund, or $1.5 million annually. And there's a 2029-2030 sunset that all the funds in the fund are returned to their source. So whether they're private funds or public dollars that are still sitting in the fund, they are to be returned to their source in the 2029-2030 fiscal year. These are the only purposes that funds can be used in the Healthcare Workforce Investment Fund. The first substantive piece of the fund includes healthcare training scholarships. At 65% of all the monies appropriated for the fund are dedicated to healthcare training scholarships. And this requires partnership proposals between healthcare programs and healthcare partners. That information is plural, and I want to highlight that because there could be multiple programs and multiple partners, and I'll have those definitions for you here shortly, involved in proposals seeking scholarship funding. It also, the scholarships are also provided only to Kentucky residents enrolled in eligible healthcare programs in Kentucky. So the statutory definitions, a healthcare program is an education or training program that is a specific requirement to an eligible healthcare credential, including but not limited to a high school healthcare vocational program. So this is any education provider, and note that there's no designation, public, private, for-profit, nonprofit, any education or training program providing those eligible credentials that I will show you shortly will be included as an eligible healthcare program. A healthcare partner is a grantor to the Healthcare Workforce Investment Fund that is a healthcare provider, a healthcare facility, a qualified mental health professional, or any healthcare or healthcare related association, individual, or corporation doing business and incorporated in laws of Kentucky. So pretty much anybody would qualify when you think about individuals or corporations, as long as they're healthcare or healthcare related groups. This is quite a long definition and makes for a busy slide, but I wanted to make sure and include all these eligible healthcare credentials. So if an educational program is offering these credentials, they become an eligible healthcare program for purposes of the bill. And again, I won't read all these to you, but there are there are several different credentials that would apply for this scholarship program. So the council will be receiving partnership proposals from these healthcare programs and healthcare providers. Scholarship distributions will be outlined in a partnership proposal And accepting proposals shall be prioritized on the following needs: targeting historically underserved counties to improve racial and ethnic diversity within a designated degree credential, by reducing the workforce demand in a specific eligible healthcare credential determined to be in high demand, and a healthcare partners with 50 or fewer employees. Now, again, these are the priorities. This is not limited to these three items, but these are just the items that the General Assembly has told us to prioritize in making awards. Partnership proposals, again, are for eligible healthcare Kentucky residents enrolled in healthcare programs in Kentucky. CPE defines residency for purposes of tuition in the administrative regulation that I have cited here. It's an extensive regulation that outlines residency requirements for students. Our public institutions are very familiar with this. Our private institutions are not, but it's very intuitive, and it gives a way to determine what we consider residency for purposes of tuition and entering our public institutions in Kentucky. The programs must be offered in Kentucky. This is something where we're going to have to define in our regulation. The regulation must determine what it means to offer programs in Kentucky. Is that Kentucky-based institutions only? Is that online providers? We're going to have to make that decision and outline that in our regulation because that's not completely defined in our in the statute. Partnership agreements, accepted proposals. So we put out a call for proposals. Partnerships, healthcare partners and healthcare programs submit proposals. If those proposals are accepted, the partnership will be captured in an agreement with the healthcare program, the healthcare partner, and CPE. So, and no disbursement of the money from the fund until the matching funds are received from the partner. So we will accept the proposal. And then once the proposal is accepted, we will take the matching funds in, put that in the healthcare workforce fund, and then the funds will be matched at least dollar for dollar with state appropriations. And so once those dollars are matched, they will be sent back out to the healthcare program to be managed by the healthcare program, because all funds are to be used for scholarships at the healthcare program, educational provider. Once these providers have these funds, they will be awarding scholarships to students. The scholarships will be awarded pursuant to the scholarship criteria listed in the partnership agreement. So in these proposals, our providers and our healthcare programs will have to outline what the criteria will be for the scholarships in the agreement, and then that will be actually captured in an agreement with the student. The healthcare program and scholarship recipient will enter into a scholarship contract. Scholarships can be used for the total cost of attendance. So that's room and board, living expenses, obviously tuition, all that sort of thing. So it can be used towards the total cost of attendance. The recipient must agree to practice in a medical profession for each year funded for a maximum of 2 years, with an obligation to repay if the service requirement is not met. And within that, our programs may include geographic or employer restrictions in the scholarship contract. So as part of the proposal, and I would suspect this will likely occur, if donors are healthcare providers and they want these graduates to go work for those entities, and they may put restrictions to say, we provided this funding for the scholarships. We need you to come work for us, and they can do that if they wish. It's not a requirement, but it's something that they can do so if they so choose. Recoupment proceedings may be initiated if the student fails to complete the terms of the contract. So there are provisions in the statute that does allow for the entities to recoup the scholarship funding if the service obligations or any other requirements of the scholarship contract are not met. Next substantive piece of the bill is the healthcare program incentives, which includes 35% of all net monies provided to the fund, all appropriations provided to the fund. It is designed to reward performance and excellence amongst eligible healthcare programs And these funds, just like the scholarship funds, we match at least dollar for dollar with monies deposited to the fund by the healthcare partner. The incentive criteria listed in the statute includes workforce demands and capacity for a specific eligible healthcare credential, workforce demands and capacity for a specific eligible healthcare credential within a historically underserved county, a percentage increase over a baseline standard in the number of students completing a healthcare program, passage rates and first-time passage rates of graduates of the healthcare program on the healthcare credential exam, and any other objective factors determined by the council to be relevant in the evaluation of performance and excellence of healthcare programs. So while there are several criteria listed in the statute, CP does have the ability to add additional factors to make these determinations to evaluate performance of these healthcare programs to provide incentive funding. CPE will solicit and accept and review applications for healthcare programs incentives and shall select healthcare programs to receive incentives and the amount based on the established criteria in the administrative regulations and the grantor dedicated funds, if applicable. And I'll talk about that in a second. Healthcare partner grantor can work with CPE in soliciting and accepting and reviewing applications funded by the grantor's fund. So we can have general donations to this fund that could be matched to provide incentives to high performing healthcare programs, or grantors can say, hey, I want to incentivize performance in this certain area. And we can work on developing what that criteria is in order to receive the funds to get those matched and provide those incentive fundings to our high performing healthcare programs within those parameters set by the grantor. However, incentives shall not be awarded to a healthcare program that has gifted or donated money to the fund for the purpose of incentive. So basically, you can't give money to yourself to be high performing. And then incentives cannot be restricted such that only one healthcare program would qualify. So if somebody can't provide a donation and say that, well, I'm interested in high performing healthcare programs, but only ones that are in Richmond that have the, that are the kernels. So sorry, Daniel, they won't be able to do that. So they got to be a little bit more broadly than that, but they can put some parameters around those funds if they so choose. Once awarded, back. Yep. Once awarded, incentive funds shall only be used for education, recruitment, and training of the healthcare program's faculty and staff, and maintenance and acquisition of medical equipment utilized by the healthcare program. So, and CP must receive proof of use of those funds, or the funds shall be returned to the healthcare workforce fund. This really highlights sort of the nature of this of the bill, with the first part being used for scholarships only, and then the incentive fundings to actually be able to be used for building out capacity, which hopefully will lead to healthcare programs being able to offer more capacity to bring in more students, which in turn could provide opportunities for more scholarship students if that extra capacity is needed. Next steps and consideration. So right now there are no appropriations to the fund, and that's not surprising as we sit here in a non-budget year that this bill was adopted. But that is giving us some time to get the parameters adopted so that funders can actually know what they would be providing funding to. So we'll see what that is coming in this next budget section, the next regular session of the General Assembly starting in January. But as we develop the regulation, just a few things to consider. Considerable detail already exists in the bill, and I've talked about all that today on how all the funds can be used, how the funds shall be administered. Administrative regulations cannot repeat information in the bill, so we'll be using what's in the bill now and supplementing what's in the bill with the regulations and administering these funds. Clear directives in this regulation are important, but some flexibility will be necessary, and I can give you a few examples to highlight that. Depending on how much money is provided to the fund, we may, a large gift could potentially eat up all the capacity or a significant amount of the capacity for the fund itself. So we may, depending on how much money there is, we'll probably need to be think about how we might want to adjust the amounts that we would be accepting depending on how much can be matched, especially considering all the different areas that can be funded, all the different credentials that can be funded, the different criteria that we're looking for in evaluating the funds for scholarships. So just something to think about. We'll definitely put some detail in the regulation, but there's probably going to need to be some flexibility included to account for all the nuances that could come up even within the years. And I'll show you in a minute a little bit how long it takes a regulation to be adopted. But as you know, wanting to be responsive to workforce needs, probably going to have a little bit of flexibility included in the regulation. But again, we'll have definitely some clear parameters to understand how it's going to be administered and what we're going to be looking for in evaluating these proposals in both the incentive area and in the area of scholarships. The first steps in the regulatory process, the bill requires that 30 days before filing with the regulations compiled, the draft regulation must be provided to the Interim Joint Committee on Education and the Interim Joint Committee on Health, Welfare, and Family Services for review and comment. And the regulation shall be filed July 1st of 2023. So as we sit here almost in May, we're running up on the time in which we're going to need to provide this information to those committees. But we are working on it and we will meet the deadline. But we've got a short turnaround here, but we're going to make it work. And we have to file by July 1st of 2023. This is a little bit of a timeline here. It gives you kind of a sense of the process to finalize regulations. In June, the CP board will approve the regulation materials. That's after they've been reviewed and we've taken the comments from those committees and consider those in developing the criteria and the regulation. And on or before July 1st, we will file the regulations with the reg compiler. Assuming that is after June the 15th, that won't make it in the administrative register until August 1st, which is public. When it will be published and public comment period begins. And I wanted to highlight this to this group is, you know, we're receiving some comments today. We'll be continuing getting feedback as we develop these regulations from different constituent groups, but there is a public comment period built into the regulation, and it was recently extended by legislation to an extra month. So there'll be significant time to provide comment to the regulation and allow CPE to make changes to the regulation based on those comments. That's just built into the process. So we will be engaging with the public on this regulation and can make changes as needed throughout the process. So in October, the end of the public comment period will likely be September 30th. Notice of public comment is due to the regulations compiler. We have to let them know if we receive comments, and I'm sure on this regulation we will. We have to respond to each and every comment that we receive. So we have to provide an individual response for each and every comment that we receive and make a determination if the comment will necessitate any changes to the regulation that we are attempting to promulgate. In November, assuming comments are received, we'll respond to each and make any changes, and we'll be on the November Administrative Regulation Review Subcommittee agenda to testify on the regulation. Now, we can seek an extension if we receive so many comments and we need a little extra time, we can. But we want to get this thing moving. We want to get it through. So our goal is to have this, on for November so that we can testify on that. After they review, assuming there are no deficiencies, the regulation will be assigned to a subject matter committee for testimony. They have 90 days to review. They can take it up within that 90 days at any time. But after the 90 days, if they haven't reviewed it, then the regulation would go into effect. But we suspect they will call us to testify. They just have to do that sometime within that 90-day window. So we're looking at a January or February date for potential finalization of the regulation. Well, that's all I have, Leslie. I'll stop.
Trying to get my picture back on the screen.
There you are.
Thank you, Travis. I know that was a lot of information for folks to take in. There's so many details of this bill. It's very multifaceted. So we do want to encourage you to drop those questions into the Q&A box. We'll also be able to look at those and answer. I think that we may have the time today to actually answer a few of those live if the panel members would like to unmute and get back on. There is a question from Julie McGregor that says, if the work commitment is not met, who collects the funds? Could you
That's
answer
probably
that,
a question
Travis?
for me, Leslie. That can be determined in the scholarship, in the agreement, in the partnership proposal, and in the agreement, and in the contract with the student. So the statute, actually, I didn't put that level of detail in there. There's already so much. I was trying to not include absolutely everything in there, but the statute does say that actually the Commonwealth can do it, or the healthcare program or the healthcare partner can be the one to recoup those funds. As a practical matter, if there's a service requirement at the healthcare partner, if it's a hospital making the donation, obviously it would make more sense for them to recover the funds, because they'll at least likely have access to a paycheck or two to recover those funds. But that can be determined by the group in the partnership.
Thank you, Travis. And then she extends the questions to ask 4% for administration, 65 for scholarships, and 35 for incentives is more than 100%. I think Representative Fleming, it looks like, is typing an answer to that on our board. Can you just speak to that, Ken?
Yeah, I was going to type it up. I don't know. I'll just mention it. Actually, the 4% or $1.5 million, whichever is met first, they'll be taken off the top. Because there's a lot of has to go into managing this fund and going through the protocols and the requirements of doing those. So that needs to be recognized up front. So you're still doing 100%, but we do have to take that off to recognize the efforts in going there, because Travis is going through, and he's got a big load in front of him. The General Assembly can go only so far, but it's a fine line sometimes in terms of how far do we go, because we need to give some flexibility to the agency and so forth. So I think we got enough flexibility for them to go through and really put a really strong program. And I want to call Travis out and Dr. Sizemore out that this is the first time that we've gotten the General Assembly a little more involved on the front end in terms of regulations. It's not because we don't trust CPE or anything, but we just thought it might give them support and more direction in terms of what our intent, so they can feel more comfortable and confident in terms of administrating the fund. And if something were to come up, then Travis and CBE would come back to us and say, hey, we need to make some tweaks or whatever in 2024. So we want to try to give them as much flexibility as possible. So he's got a yeoman's lift to go through. And I know he's going to do a good job. He's already asking some questions already before this for this meeting.
Thank you, Representative Fleming. Any other questions? Oh, go ahead.
That it was that amount to Representative Fleming's point is the net. So it's the 65 and the 35 is the net after and that's in the statute. Actually, I think I put that on one qualification in one of the sections and not the other, but it is the net. So
thank you for that clarification. Okay, any other questions that anyone wants to present to the panelists live or make while we're in our meeting today? Or if you'd like to just, I see another question that came in. Will CPE provide a template or a standard language for the scholarship contract with students? And I think I can speak to that in saying that the scholarship contract would be, of course, with the campuses, between the campuses and the student, or between the partnerships, I guess I should say, and the student. But Travis, do you think we'll be providing any template, or do you think that it'll be something that the campuses generate?
I think it would be something that we probably will do. And if there's a need for the group for that, I don't think we would incorporate it into the regulation to make it a requirement that you use this particular contract, but just as guidance and assistance to those that might need it, it would probably be a good idea. And if there's if that's requested and there's a significant need, then we could certainly pull something together that would just be for general guidance and not mandatory.
Mm-hmm.
Dr. Sizemore, going up to Ms. McGregor's question in terms of will the state match both scholarship? Was that answered?
No, it was not yet.
Okay, well, just let her know. The state is going to be putting money in based on what comes in from the private sector. And that will go into a pot. And then whatever the pot is, it's going to be broken up between 65 or 65 and 35%. So there's not like, we will only go, the state will only go and contribute money for one part of the equation than the other. So it goes in a pot, and then CPE will go through that process and look at the formula and base that decision on what they come up with in terms of the requirements and protocols.
Thank you for that. I just want to say a big thank you to these panelists today, and a big thank you to our guests. We have a significant number of participants. There is a lot of excitement around this bill, and we really appreciate the input and the questions, because all of that information allows us to be more directed in the regulatory process. So as we are developing those regulations, this information from our participants is very critical. So following the webinar, you will receive a survey with some targeted questions, and we would be most grateful if you fill that out and submit it. That'll help us again as we're on this journey. And we do appreciate the interest in House Bill 200, and we really look forward to that implementation. Appreciate everyone's attendance today, appreciate our panelists, and with that, we will say goodbye and end our webinar for today.